What is FUE shock loss after a hair transplant? Imagine waking up after a hair transplant and noticing some hair shedding. That's what we call shock loss. It is a common part of the healing process following a follicular unit extraction hair transplant. During this procedure, individual hair follicles are carefully removed from the donor area and transplanted into areas experiencing thinning or baldness. Shock loss refers to the temporary shedding of both transplanted hairs and some of the natural hairs nearby. This shedding can look concerning but is actually a normal response to the surgical trauma. It does not mean the transplant has failed or that the procedure was unsuccessful. Instead, it signals that the scalp is reacting to the surgery by entering a temporary resting phase for some hair follicles. Understanding how this happens helps clarify why shock loss occurs. During FUE surgery, tiny punches are used to extract hair follicles, which temporarily disrupts blood flow and causes stress to the scalp tissue. The trauma triggers a process called localized telogen effluvium, where hair follicles prematurely enter the resting phase of the hair cycle. Normally, hair grows in cycles with phases of growth, rest, and shedding. When follicles are pushed into the resting phase because of surgery, they shed their hair shafts. This shedding usually happens within the first few weeks after the procedure, often starting around 10 days to 2 weeks, and peaks at about 1 month. The entire shock loss phase can last up to 12 weeks, after which most hair begins to regrow. Shock loss can affect different areas. Transplanted hairs may fall out temporarily, but the grafts themselves remain viable and will grow back. Natural hairs near the transplant site can also shed due to inflammation or microtrauma caused during the procedure. Less commonly, hair loss can occur in the donor area if blood vessels are affected during follicle removal. Factors influencing shock loss include the size of the punches used, the surgeon's skill, the number of grafts, and individual sensitivity to trauma. For example, larger punches or densely packed grafts can increase the likelihood of shock loss. Patients with a more inflammatory response may experience more shedding. Most patients notice shedding within 2 to 3 weeks after surgery. It can be alarming to see hair falling out, but it is a sign that the scalp is healing and that the follicles are preparing to re-enter the growth phase. As the healing continues, new hair begins to grow from the transplanted follicles, usually starting a few months after the procedure. It is important to remember that, in most cases, shock loss is temporary. The hair that falls out will typically regrow, and the final results of the transplant become visible after several months. Permanent shock loss is rare but can happen if the hair loss was already due to genetic pattern baldness or if the surgical technique caused damage to neighboring follicles. That's why choosing an experienced surgeon who uses precise techniques is essential. To reduce the risk of shock loss, surgeons often use advanced FUE methods like Sapphire FUE or DHI, which are less invasive and cause less trauma. Proper graft placement, avoiding overharvesting of the donor area, and using appropriate graft densities also help minimize shock loss. From a plastic surgery perspective, understanding shock loss is crucial for setting realistic expectations. Patients should be informed that some shedding is normal and temporary. Knowing that this shedding indicates the process is working correctly can help ease anxiety and promote patience. Ultimately, shock loss is a sign that the scalp is responding as it should, and with time, healthy new hair will grow, revealing the full benefits of the hair restoration. Always consult with a qualified medical professional for personalized advice and to ensure the best possible outcome.